episode of Progress, Potential, and Possibilities, discussions with fascinating people designing a better tomorrow for all of us. I'm your host, Ira Pastor. Welcome everybody again to another episode of our show with another really fascinating guest for you today, helping to create a better tomorrow on a variety of fronts. And today we have the honor of being joined by Mr. Siva Balu, who is a Vice President and Chief Information Officer at YMCA of the United States, where he works to ultimately rethink, reorganize the work of the organization's information technology strategy to ultimately meet the changing needs of the headquarters of the Y and the Ys, of course, throughout the country. And as little background, the Y is the leading nonprofit that's committed to strengthening community, connecting people to a potential purpose and each other, ultimately with a focus on empowering young people, improving health and well-being, inspiring action in and across communities. And with their presence over 10,000 neighborhoods in the United States nowadays, they really have the ability to deliver a lot of positive change. Mr. Balu has 20 years of healthcare technology experience, most recently in leadership roles for Blue Cross and Blue Shield, our nation's largest health insurer, which ultimately provides healthcare to over 100 million members, around 1 in 3 Americans. Most recently, he led the Enterprise Information Technology team at Blue Cross Blue Shield Association, which is the National Federation of Blue Cross and Blue Shield companies. He was responsible for leading all aspects of information technology, including architecture, application, product development, big data, business intelligence and data analytics, information security, project management, and digital infrastructure and operations. He created several highly scalable innovation solutions catering to the members of Blue Cross Blue Shield throughout the country, throughout communities. Provided leadership in creating these innovative solutions, adopting new technologies for both national and their international users. Mr. Balu earned a bachelor's degree in electronics and communication and engineering from Bharathiar University in India, his master's in business administration from Lake Forest Graduate School of Management, and executive master's degree from NIT Sloan School of Management, Innovation Strategy, and Artificial Intelligence, as well as additional certifications in disruptive strategy and negotiation mastery from Harvard Business School. In his free time, Mr. Balu volunteers and contributes to several charities, including the Sundra Foundation, which delivers healthcare to the working poor in India, the Special Olympics, Chicago Food Depository, Challenged Athletes Foundation, Beyond Hunger, the Pack Shack, Kratos the Crowns, and Gardeneers. Aside from all of that, Mr. Balu is also has a strong interest and passion in long-distance running, having completed multiple ultra marathons, and we'll get into that a little later on in the show. But to start out, Mr. Siva Balu, thanks so much for taking the time out of your schedule today to join us.
Ira, thank you so much for having me here.
It's great having you. I love to start things off like we typically do, just by handing you the floor for a little bit to talk about yourself. If you could take us back a little bit to sort of the beginning, everything from where you grew up, how you developed these interests in electronics and communications and business, and ultimately a little bit of your career journey through sort of the healthcare industry. I think that'd be a great way to start things off.
Sure. So I grew up in India until I moved here to the U.S. around now 21 years ago. When I was growing up, I was from very humble beginnings, single mom, teacher, and we were relatively poor. We didn't have a lot of resources. The only way for me to grow and get out of that was education. So I can't remember playing any sports or doing anything else after the age of 14 or 15. I actually focused fully on academics. It's also the culture of India where there's a lot of emphasis on academics than anything else. I would say that we were so focused that we didn't have TV or other things. And that really helped me to gain a lot of academic knowledge. And I actually, I'm curious by nature. So I sought out, say, teachers, professors, other intellectual folks who can help me grow when I was in my teenage. I did my bachelor's in electronics and communication engineering. One of the reasons why I gravitated towards that is because I was always curious about how things are put together, how things work. And I had a choice to go to med school or engineering. And my mom still says I should have become a doctor, but I chose to go to electronics. If you go back in time in the mid 90s, technology was not like today. There was not a lot of
Sure.
software. So the idea was, if I studied electronics and communication, I can either go the software route, like information technology, or I can go the hardware route, which could be think about satellites, rockets, dishes, things like that. And I was actually recruited out of college, and I was sent here for my internship to work for Blue Cross Blue Shield. And that was my journey to here. And after my internship, Blue Cross Blue Shield hired me to be a software engineer. And I actually, the story is really, I started as an intern and I ended up at a CIO level and over a 20 years period. But I would say that it was not as fast as I just mentioned. uh, I was very fortunate enough to have bosses who became mentors, and they saw the potential in me early on, and they helped groom me, mentor me, and grow me. Think of the big ticket items like whether it is HIPAA, which was around
Sure.
2000, whether it is Affordable Care Act, or what's called as Obamacare, or all other mandates or all other requirements that came through. I had worked on all those projects. And I became a manager early on in my career when I was like 24 or 25, because I was taking on more responsibilities when I was a programmer. So what I used to do is I actually will finish my coding or whatever software I had to develop, and I'll work with project managers and product leaders and try to learn what they were doing. So that helped me grow faster. And I was put in a fast track in the leadership in my late 20s. And that really aligned with what I was doing at work. I built the first cloud-based SaaS claim system
Okay.
in the late 2000s, which is unheard of, right, at that time in 2007, 2008. Every Blue Cross Blue Shield company had their own mainframe, their own data center. They couldn't fathom the thought of their HIPAA claims getting out of their premises and coming back in.
Right.
So we were able to prove that concept, and that really evolved my role into taking on other responsibilities over time, in addition to building and scaling a huge claims platform that was totally like a cloud solution, like a private cloud. Over time, I was leading the big data effort. I also was responsible for federal employee program technology, which is most of the federal employees are insured with Blue Cross Blue Shield, and took on the role of IT infrastructure operations.
Mm-hmm.
And that actually evolved to artificial intelligence, blockchain, and other technological advances. So think of it as my personal growth and what I was doing in my job, which aligned with also my education, because I went to school and I got my master's and executive master's to kind of build myself and grow myself.
Outstanding journey. Very, very outstanding journey. And here you are now. You're vice president, CIO at the Y of the United States. And before we were talking, I'm sitting here in downtown Philadelphia, and literally about a mile in that direction is a Y. My children learned to swim there. But I never thought much of the organization. And you're talking about a very large organization in Blue Cross Blue Shield. The Y is no joke. I was looking up some of this data: 2,700 locations, 10,000 communities, 19,000 full-time staff, 600,000 volunteers, and that's just the United States. It goes into the millions worldwide. Talk us a little bit about the Y organization. I mean, also, did you experience the Y outside of the United States as well when you were in India? I'm curious about that as well. But talk a little bit about the history of the organization, and then obviously, how you decide to do what you do on a given day with all this responsibility.
Great question. Just extending my previous response, I've been in this role for almost a year now, actually a year tomorrow. And it evolved. It's a role that actually came around in between COVID. Think of like taking a role when we were 2 months into COVID, which was in May of last year, and moving from a big brand like Blue Cross Blue Shield to another brand like Y, when a lot of things were really uncertain. But I'll come to that in a minute. The role itself is to make a it can have an impact around the country. And I think that was very compelling for me. And it aligned with a lot of nonprofit work I was doing in my free time, outside of work. So there are many reasons. It's a longer story, but I took this role as opportunity was so powerful that anything we do in the next couple, 3 years will have a longer impact, like you mentioned, in those 10,000 communities for a long time. Talking about a little bit of history of the Y and my experience, I knew of the Y when I was growing up, but we didn't have the means to get the membership or go and enroll in a Y. Interesting fact, after I joined the Y, last year I was doing some research about my own family tree, and my grandfather used to be a member of parliament in India, so they have digitized all his records. And at one point, he was a president of a YMCA chapter in India, which I was not aware of when I took this role. So
Small world.
exactly. Talking a little bit about the Y, right? The Y brand itself has been around for almost, I think, 175 years. And within the U.S., there are, like I said, around 2,700 YMCA branches, and which is enormous because the brand and the YMCA facilities offer so many programs to so many individuals and citizens around the country. I'm also learning about the Y every day, something new. And what I'm trying to understand is it's not one size fits all. As an example, the YMCA in Philadelphia might offer totally different programs for the members and participants than the YMCA in Boise, Idaho.
Sure.
That's like the beauty of a federated brand like a Y.
Mm-hmm.
And there are a lot of similarities between Blue Cross Blue Shield and the Y.
Yep.
Both are federated, both are very locally focused, so they can actually have a concentrated impact in a local community. So that's kind of the Y. Now we can go into the details of the technology and how the Y is, evolving. But I'll just pause to see if you have any other questions before I move into that.
Yeah, no, keep going because we'll do the technology a little later on. I'll package that up into to a separate question, but keep going. Take your time.
Okay, wonderful. So the way that the Y is structured is these 2,700 branches roll up to around 800 corporate offices.
Okay.
And then we have the national office, which is which is where I'm working. So the corporate office is the best way to think about it. And I try to explain this to my friends and family. Let's say Philadelphia might have 15 YMCA branches,
Mm-hmm.
but they might have one corporate office with one CEO and one administrative roles and whatnot. So there are 800 corporate offices, and they're of many sizes and many communities. Over the years, each of those corporate offices or YMCA associations is what we call have had either extended impact, or sometimes they run into some issues. They partner with other YMCAs. So there's all flavors of YMCAs. What people, when you think about YMCA, a layperson might think that's where I go to have my kids learn to swim. That's where I go to have a gym, typically. But most of them here may not even prefer to be called as a gym and swim. What has happened is the YMCA has really truly become a community organization. Think of community health or population health. Healthy living is one of our mission, as well as it is not just for younger demographics. Let's say there is a age range of 2 to 17 who might go there for all kinds of youth programs. And then there could be an age range of 20 to 45 who might go to the Y because their kids are going to the Y and they want to take some programs. And then there is 55 and above, and there are a lot of programs for seniors and aging adults. In addition to just the programs for the members, there are all kinds of community partnership. So where I live, the local Y has partnership with all the colleges and school districts. So if you're a teacher, and if you take a biometrics test, and if you are prone to diabetes, you can actually go to the Y to enroll in a free diabetes prevention program, as well as you can get access to the Y and all the digital and physical facilities that's available to you. So There is just so many programs, including recently when COVID hit, several Ys reinvented themselves to be food distribution centers. If you just Google Y on COVID, you will see a ton of articles on how the Ys have actually rebranded themselves to help the communities where there is food shortage. Many Ys have converted to COVID vaccination centers. So some of the CEOs actually tell me that we never say no. If somebody comes to us and say, hey, we have this idea for partnership, it's always a yes. And I have my own personal experience having that, when I went to some Ys with some ideas, they always said yes and try to make it happen.
And continuing down that path now, thinking, because you mentioned healthy living, and once again I was looking at some of these programs, which are fascinating, of the community integrated health, where you do the diabetes prevention, healthier communities initiative, family time initiative, a lot of really great stuff. And obviously you mentioned sort of the flexibility over the last year. Talk just a little bit more about sort of the healthy living portfolio you would, and then based on your experience in healthcare and building technologies at an organization like Blue Cross Blue Shield for the last 20 years. Obviously, this data is different, but there's a lot of it coming to you from all angles. Begin to introduce a little bit here of some of the tools. You specialized in artificial intelligence, machine learning, things of this nature. Talk about some of these new tools that we've talked about on previous shows, and how they're making your job in crunching all this data and being flexible easier in a 2021 world.
Yeah, absolutely. Yeah, let me break it down to a few parts. The healthy living, right? We look at healthy living as a comprehensive, 360 view of a member. So it's not just going to the gym for 1 hour a day and working out. It's also, are you connected with the community? Yep. Earlier I mentioned there are various age groups. Think about just the kids who may come for swim lessons or aquatics. They form a community, right? They actually know other kids in the same location or locality. There are parents who get to know each other, and there are programs for them to actually come back to the Y and use the facilities beyond aquatics. Similarly, for aging adults 55 and above, there are several programs that actually helps them to be more connected to the community. Beyond the healthy living, there are also nutrition programs. There are many Ys that has health coaches that actually help you with better eating. And then extending that to avoiding isolation, right? The last 1 year is nothing else, like everybody is isolated. So we have used technology to help reduce the impacts of isolation, thereby increasing the mental health benefits. Yep. And there are programs, usually we use terms like, aging adult programs or silver sneakers or like something related to that. But the key is, it is not one thing that makes a Y beneficial to the healthy living. It's many things. And we truly believe in the end-to-end well-being of our members, not just fitness classes. Sure. So that's kind of the healthy living. And I can go on and on, but you get the point of educational programs, so on and so forth. Talking about technology, right? Let me just say a little bit on the background. For the last 5 to 6 years, I've been fascinated with the data that is coming that highlights what's called as the social determinants of health. Yep. To some extent, I got very passionate about the social determinants of health. Basically, the idea is, for those who may not be familiar, if you have a healthy living, if you have a good family surrounding, good housing, good education, and just in general, good friends and whatnot, then your health risks are lower. Your social determinants of health are not impacting you. Versus if you have some of those factors that is not available to you, your health risk can go up. At Blue Cross Blue Shield, we created a big data warehouse called Community Health Management Hub. We have our own private data. We are sitting on around 19 billion medical claims, plus 185 million lives, like data from the members. Obviously, it's desensitized and anonymized. So you can actually look at the data without knowing whose data it is. We use that to identify the top 4 social determinants of health. What are the things that's impacting our members? It's actually, you'll be surprised, transportation is one, followed by food or nutrition, and then pharmacy, access to pharmacy, and then fitness. And this actually nicely ties to what I'm doing now. But what we did there is we actually took on the transportation and tackled it. We built a platform that used AI, ML, and NLP to basically identify if somebody is a member and they don't have access to go to the doctor's office for non-emergency medical transportation, how can we provide them free transportation as part of their benefits? So that's a problem we try to solve.
Sure.
And if you think about it, an area like Chicago, you might think there's public transport, there's taxi cabs, you can easily go to it. We found out that that is not always true. There were so many members who actually had to rely on their family members to take them to dialysis for two times a week, which means a family member now has to take the day off, or had to sacrifice their day to come and give them the transportation. So we actually built this AI-driven platform to give a free transportation to members to go to the providers and then back. Over time, that actually increased from just to go to your doctor's visit to you may want to go to your local church to get your fitness classes. Many churches provides classes and whatnot. So that actually taught me a lot about how one factor of social determinants of health can improve the lives of any age, but primarily we were focusing on folks who were under Medicare, Medicare Advantage, and Medicaid, because they were the ones who were not having access to transportation. Now, extending the thought process towards the why, we also have a national data warehouse where we collect all kinds of data from around the country. Think of it as the membership data, the usage data, and then we pull a lot of public information like demographics, which society or which community or which zip code has what kind of demographics, what is the earning capacity, who's coming to the Y from that. And interesting facts pop up from that analytics. For example, most of the teenagers who come to certain zip codes could be white teenagers. But the zip code itself can have a higher population of non-white teenagers. So the problem that we will try to solve is how can we give those non-white teenagers access to the Y? And why are they not coming to the Y? Is it economics? Is it family situation? So I think the data can do a lot of things if you zoom out and look at it from a problem statement perspective. Like, what are we trying to accomplish? What is the problem we are trying to solve? What is the strategy we want to give forward? So today, we are sitting in a treasure trove of data. I would say we're using it 25 to 40% effectively. There's a long way to go ahead of it. You had asked about how do we use the new technologies, AI, ML. Now, traditionally, the Y, since it's a federated model, has invested in technology, I would say, in pockets throughout the country. So as an example, some big cities might have invested more on technology and digital. Many rural and small cities may not have invested, not because they didn't want to, because there was no need to do that. You just need the technology to run the facilities. With COVID, all that is out the door because overnight, all the branches were shut down and we were forced to expedite our innovation. And one of the things that I'm doing, that's the reason they brought me in, is to help lead the digital transformation to catch up to what we have not invested, as well as to push us forward, looking the next 5 to 10 years. So everything we are delivering in a branch, we want to be able to deliver virtually. Whether if you have fitness classes, we want to provide virtual Y, where you can take classes at home. You go to the Y for diabetes prevention program. You can actually talk to your health coach on a platform that is secure, as well as you can confidentially transact with your provider. Now we are tying that use case with the data we have, and we are identifying. I talked about one example where we want to focus on diversity, equity, and inclusion. So that's the reason we are looking at what are all the areas in the country where maybe there is not a branch, but can we deliver a digital platform that they
Mhm.
can access our programs? So that's kind of in the beginning stages. I call this as year zero.
Mhm.
Coming out of COVID, we want to start building that framework. And I have a master's in AI, which actually gives me context outside the Y who
Sure.
want to help and contribute to a great cause like the YMCA.
Very great. And I'm glad you mentioned the social determinants of health because that's been a recurring theme for us on the show as well. And then sort of one aspect that sort of the intergenerational component of this. We want to obviously reduce the social isolation, but also there's this very important dynamic in play when the elderly come together with youth. And they can learn from each other, benefit from each other, and I think that's another really important component. I was reading about, I talked about it offline a little bit with you, this healthy aging
Yeah.
program. I think it was up in maybe outside of Boston, working with the councils on aging up there with the local Y. And once again, as you were saying, putting these things together, obviously the online component, but the rides, and then some of these really innovative programs to even combining fitness with socialization, coffee hours, very, very comprehensive integrated model. And I think that's extremely, it's a wonderful example of how you have the ability to bring everything together like this. It's very nice to see. Um, you know, Obviously nothing confidential, but other visions of yours, whether they are other types of technologies beyond what we just discussed with the AI, and other models that you're thinking of now, as you're saying, year zero, we're coming out of it. Obviously, again, nothing confidential, but any other interesting programs that you're thinking about that you could talk about on the show?
Yeah, absolutely. And even though I come from a technology background, I tend to think like technology is here to help our mission or our business or our customers, right? What we are looking at is really uh, because we are a federated model. While there are so many benefits of catering to the needs of the local communities, very powerful and very impactful, it also brings some challenges, right? Because now we have 800 or 2,700 different technology footprint because they're all independent of each other. So if you look at some big brands that has been very successful is they have one platform behind the scenes. Like think of AWS or Azure or Salesforce, or I can go on and on.
Sure.
So there's a lot of synergy on first, how can we get some of our foundational digital technology together so that our members, whether they are in the East Coast or West Coast, get a seamless, similar experience when they think of the Y. When most people think of the Y, they think of the brand, like one brand. But you and I know that there is YMCA of Philadelphia versus YMCA of Chicago, and
Yep.
so on and so forth. But from a digital standpoint, there is no boundaries. We can actually have one platform.
Sure.
So currently, we have focused on digital quite a bit. In fact, coming out of COVID, we set ourselves at the national office three priorities: diversity, equity, and inclusion, digital transformation, and financial sustainability and growth. Just talking about digital transformation, we want to rethink how the YMCA offers membership.
Mhm.
We want to rethink how the YMCA offers programs. We have, in the last 10 months or so, high success in the digital space in connecting with our members. For those who are unable to come into the branches, we're able to deliver the digital programs. Now, we want to extend it to say that for example, when you think of swimming or aquatics, you think you have to go into the branch. What if we provide aquatics lessons virtually, and then you take it at your own convenience?
Hmm.
Your kids take it at their own convenience, like safety or whatever teaching techniques, so on and so forth. And then they come to the branch only for the swimming times. So we are actually rethinking the way we deliver every program. That also extends to our chronic disease prevention programs, where we want to have a hybrid model. When things open up, the folks can either come in or they can actually use technology in their living room to take the same programs. So those are some of our short-term, I would say, 1 to 2 year footprint. We are looking at rethinking the why, how we can have common universal platforms, as well as extending it to mobility, right?
Mhm.
I'm leading an effort to build a platform called the White Cloud. It's really a digital platform that delivers digital, virtual, and mobile products and offerings to the members. I think of an ecosystem that we are building
Yep.
among the members. So that's our next 2 years or so. In parallel, we're looking at how can we use data to make us better. Like I would call it as business model innovation. So a lot of this is still in motion. Something to keep in mind is we are still not 100% out of COVID, right? Every area opens up
Sure.
differently. There's a lot of real life challenges. We have other government like TTP and other things we had to deal with. So putting the digital in the forefront helps us to propel some of it.
You know, aside from delivering the positive change, as you're definitely doing, as you mentioned, 2,700 Ys and 10,000 communities, you do a lot of other things. So, you are on the board of the Sundra Foundation, which is involved in delivering healthcare to the working poor in India. You're involved with a domestic violence organization, Sarah's In, a wide range of healthy living nonprofits. Um, uh, there's a limited amount of time in a day, but obviously, can you talk a little bit about some of these initiatives and when you got interested in these particular organizations?
Absolutely. I would say around 2008, I still remember the time when I was deeply impacted by the nonprofits when I was pretty young. And I went to volunteer at the Special Olympics for a week. And
Mm,
I would say that was the most impactful event I had, which changed my thought process. For those who may not be familiar with Special Olympics, this is a week-long event in different chapters around the country. And I went to the Chicago chapter where kids with physical disabilities come to play sports. And just volunteering there, looking at the kids, had a huge impact in my life. And I kind of determined that I'm going to spend my free time in helping who cannot, have the ability to do that. And since then, I started volunteering very actively in my free time in various charities like the Chicago Food Bank,
mhm.
and we also had a volunteer program at Blue Cross Blue Shield, which helped me to reach out to other nonprofits. Around a couple, 3 years ago, I was asked to be in the board of a nonprofit. And that's when my journey kind of pivoted and I started, okay, let me help them in a different capacity. Rather than being a volunteer and volunteering once a month or once in 2 months, I can actually be an active member in helping some of these nonprofits. So right now I'm in 4 different nonprofits. For most of it relates to health in some aspects, physical or mental health, and it gives me a lot of personal satisfaction. And also, because of my upbringing, I think you need to have goals in career, but your life should have a purpose.
Yep.
And I'm kind of chasing that purpose. And I'm also learning how nonprofits work. What are the challenges? It is not easy to run a nonprofit. I can say that much. And now my full-time job is also at one of the largest nonprofits, which is the YMCA. So it almost looks like my professional and personal life is blurred to some extent.
Yep.
And I take my learnings from my professional life, apply it to the nonprofits I'm on the board, and the reverse also happens.
Uh, Now, see, on a totally unrelated topic, although related because you're involved in it, you, aside from running this organization and being involved in all these nonprofits, you are a quite accomplished, very long distance runner, having completed multiple ultra marathons, including the Badwater 135-mile in Death Valley and the Scobie 160-mile race, one of the coldest races. Um, I've at my best shape in life, I've maybe run about 3 miles ever. I don't even like driving 100 miles, but talk a little bit, just if you would, about because you only started doing this a couple of years ago. Sort of how you worked up from a couple miles to hundreds of miles, and at the same time, just interested. About last year, I had a special forces guy on the show named Dean Stott, who was known for biking the Pan American Highway from down in Chile up to Alaska and back. And I was just a question, well, what's next? After you run 160 miles, anything else? You're going to swim in ocean or anything else planned in terms of these ultra activities that you're involved in?
Yeah, yeah. Not swimming in the ocean because I'm just starting to take swim lessons at the local Y here.
There you go.
So, running actually is a totally spontaneous thing that happened in my life. Earlier, I mentioned that I didn't play sports since I was like 15 years old. So I was totally focused on career, academics. I also gained a lot of weight. And there's a significant event that happened in my life that I thought, you know what, I should probably relook at what I'm doing. While I can work 20 hours a day, 16 hours a day, 7 days a week, that's not the end all. So I actually had some friends who are training for Boston Marathon. So I just went to watch the Boston Marathon in 2012, and it really ignited something in me. And when I went and joined like a 5K training. I don't know if you heard about Couch to 5K training program. So it is just you have like 3 months to train from couch to 5K,
Okay.
like a race. And I figured out pretty quickly that I'm not too fast. To run Boston Marathon, you have to be pretty fast and in the best shape. I think it's also a character type that I don't take a lot of things, but when I take, I'm fully in it. So I went from a 5K to a marathon within 5 months time, and then from a marathon to ultra marathon within a couple of years. So any distance that's more than 26.2 miles, it's an ultra marathon.
Okay.
Usually people run a 50K, which is 31 miles, which is an ultra marathon. But when I learned that there is this race called 100 miles, it was mind blown. Like I couldn't believe humans could run 100-mile races. So I just signed up for that. I think I signed up for that before running my 50K. So usually you build it over 10 years or something like that. And I had 6-7 months to train for it. I took it pretty seriously. I woke up at 4 o'clock every morning and went out for a run 7 days a week. Probably that's not the best way to train because you need to recover, but I didn't know any better. I didn't talk to anybody. I didn't tell my family or friends that I'm going to run 100 miles. Only 2 of my friends knew that, and they came and supported me in the race. And I got really excited when I finished the 100 miles. Like, is this possible by humans? And it gave me a lot of perspective. Like when I finished it for a couple of weeks, I was in the state of like I was levitating in my mind. I was calm. I was not getting angry or whatnot. So in a very short period of time, I ended up running, I want to say around 10 100-mile races within 2 years.
Wow.
And that actually qualified me, and I was invited to run this race called Badwater 135. It is called as the toughest foot race on the planet. It is in Death Valley in the middle of summer. And it's invitational. You can't just buy your way into it. You have to actually qualify, and there's a committee that selects 100 runners every year internationally. And I was fortunate enough to be invited in 2019 to come and run that race. And that actually put me in the map of ultra running because most ultra runners or marathon runners aspire to be a Badwater runner. And that would be my all-time accomplishments. The race starts 220 feet below sea level in the Badwater Basin, and it goes down around 1,800 feet above sea level in the highest point of Mount Whitney. And you go through 3 mountain ranges, all on road, around 130, 135 degrees temperature the entire time. So a lot of things can happen in 135 miles in 135 degrees. I finished it. I'm going to call it a day. And then I learned about this other race called Tuscobia, which is one of the coldest races, where you actually have no support. You carry all your stuff, food, water, in your, like you actually pull it in a sled behind you I ran this 160 miles with no sleep for 3 days and 3 nights, straight up. And right after that, COVID hit. And I was going to run a 100-mile race on March 22nd, 2020, which got canceled because the week before that, everything shut down. And coincidentally, this weekend, in 5 days, I'll be running 100 miles in Indianapolis. I think it's my coming out of COVID kind of sign. So I'm actually I can pull through pain, I figured out. I'm slow but steady. and I don't give up easily. So those three works well for ultra marathons.
Those are admirable qualities. I take my hat off to you. I'll be there with you in spirit.
I actually want to add one more thing. Like we talked about the Y,
Yeah.
we call it the local Y, the Y nearby my house, a mile away. I met the CEO and I was talking to him, and he wanted me to be on their board. And I said, hey, can I use one of your treadmills to run a race? And he's like, oh, sure. And I ended up running 100 miles on a treadmill in December of 2020 in between COVID. It's called Red Mill 100, and that was to raise funds for another nonprofit that I was supporting called the Sarah Sin that supports victims and families of domestic violence. So
Yeah.
I just use this now to bring more awareness to the causes and
Yeah.
supporting. It's absolutely not about me anymore,
Sure.
and I like to keep a low profile of my running.
But I did see that article about you. That was extremely impressive as well. Although I don't think I could even on the treadmill could could go along with you. But
Stuff on the treadmill and running in that order because
that's
you just
true.
okay.
No rattlesnakes. Siva, I'd like to, as we're coming to the wrap up here, I'd like to sort of give things back to you and just, typically ask our guests about mentors, influencers, other folks in their life or in the past that have been extremely influential, important along your journey. Please take a couple minutes just to mention, shout out to anybody that you want that has been, if it wasn't for them, Siva Balu would be off practicing law or selling real estate or doing something totally different. Take your time with that one if you would.
Yeah, 100%. I would say there's so many people who influenced me, including my wife and my family. But there are pivotal points in my life, both personally and professionally, that I can actually go back in time and look and say, this is the reason I'm here. This is the reason this happened. One of it definitely would be my mom. She gave up everything to, educate me and, get me out of the state we were in, which was very humble and very poor. And I still talk to her very frequently, and she lives in India, but we communicate quite a bit. And that's one person that is solely responsible for who I am today. And my sister, who also, we actually were in a small, house when we grew up, and we became very close. Apart from that, in a career, there are some of my bosses who became my mentors who I still talk to, even though they are all retired. There's a gentleman named Neil Sands. He actually spent 42 years at Blue Cross Blue Shield, and he retired and came back as a consultant. He's still around over 50 years. He's with Blue Cross Blue Shield in his career. And I worked for him around the time when my career really took a turn where I got a shot in the arm because he gave me a lot of space to grow. And whenever I made a mistake or lost my cool, he would always mentor me in a way that was like fatherly, right? And I still talk to him when I need some advice or input. I go to him. And recently, I created this, I call it personal board of directors. I have a few folks who became friends, almost like family over time. And I keep in touch, especially after COVID. I actually made a point to reach out to them every other week or every month. And those are the folks I actually reach out and kind of, everybody needs a sounding board. The one thing I would say is for anybody listening, you never know what impact you can have in somebody else's life. It doesn't always need to be in social media. It doesn't always need to be like well known. It can always be like quiet and behind the scenes.
Yep.
But I, because of my personal experience, that I have been both positively and not positively impacted in some cases. But I will always look at the positive side of things and say, these are the things and these are the folks who had an impact in my life. I would say you might have an impact on folks that you don't even realize. So I carry around a positive mind frame. I kind of reset myself every morning with a run and a positive, energy. And I can now, I'm at a point where I can actually sense when a negative energy is coming up, either within me or in a meeting or a Zoom
Yep.
call. So I try to, diffuse that and reset whenever possible. So I would say impact, our time here is very limited. I think if we can have any impact even on a single soul, I'll be happy for that. And I would say all of us will definitely have an impact on others, knowingly or unknowingly.
Outstanding message. Great way to wrap things up. Siva, it's been great talking to you. I really wish you the best with everything you do at the Y, for all the nonprofits, for the upcoming race. For everybody that is going to be listening to this particular episode on the podcast or watching on the YouTube channel, you've been spending time with Siva Balu, Vice President and Chief Information Officer of YMCA of the United States. Siva, it was a really great time spending with you. I just want to thank you for taking the time out of your schedule to talk with us. Thank you for everything you're doing, both at the Y and through these various organizations. And as we say on our show, thank you for helping to create a better tomorrow through all your initiatives. Very, very inspiring work.
Thank you very much for having me, Ira. It was a pleasure being here and talking to you today.